Hello everyone, welcome to our latest Queen Elizabeth Scholarship webinar. We are joining you today live from the McMaster Health Forum at McMaster University in Hamilton, Ontario. The agenda for today is I'll give you a quick little summary of the McMaster Health Forum, the Queen Elizabeth Scholarship Program, and then I'll introduce you to our Queen Elizabeth Scholar, Ben Lee, who was an intern in Sydney, Australia in this past summer, and then we'll have an opportunity for questions. The McMaster Health Forum is a leading hub for improving health outcomes through collective problem solving. The mandate is to harness information, convene stakeholders, prepare action-oriented leaders, and act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is run by a partnership between Rideau Hall Foundation, Community Foundations of Canada, Universities Canada, and Canadian universities. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Here at the Forum, our Queen Elizabeth Scholarship Program is entitled Strengthening Health Systems. Our scholars contribute to strengthening health systems and become part of our large and growing network of health system leaders. Here is a list of our current incoming scholars and outgoing interns. Our presentation today is by our outgoing intern, Ben Lee. At the time of his internship, Ben was an undergraduate student in the Bachelor of Health Sciences program at McMaster University. Prior to his internship, he was a fellow at the McMaster Health Forum and contributed to a number of initiatives, including synthesizing information for evidence briefs that inform stakeholder dialogues and citizen panels, conducting an evaluation of the rapid response program, and organizing student-led events on topical health issues. Ben is currently a MD student at the University of Toronto's Faculty of Medicine. So, without further ado, I'll turn it over to you, Ben.
Hi, everyone. Thank you, James, for inviting me back to the forum to speak about my QAS scholar experiences. Today, I'll be talking about my experiences working at the New South Wales Ministry of Health in Sydney, Australia. I was an intern this past summer, and I'm currently an MD candidate at the University of Toronto, and I graduated from the BHSC program this fall. So this is a map of Australia. It's divided into 6 states and 2 territories. And I worked at the New South Wales Ministry of Health, which headquarters is located in Sydney, which is right there. And so today I'm going to be talking about 4 things. Why I chose Australia, some of the things that I did to prepare for my trip, 3 projects that I worked on, and some of my reflections coming back to Canada. So for those of you who are interested in becoming QAS interns or scholars, one of the most important decisions that you'll have to make is deciding on where to go. And one of the biggest reasons I chose Australia was that it was far away and it was outside my comfort zone. It was halfway around the world, and I knew that spending 3 months in Australia would help me grow and become more independent as a young adult. And I really wanted to gain experience working in government, and going to Australia, specifically the New South Wales Ministry of Health, would allow me to see how policymakers use research evidence to make decisions about some of the policies and programs that they would be funding. And Australia itself is a beautiful country. As you can see here on the right is a picture of Sydney. Right in the center of the city is a harbor. You can see the Opera House, the Central Business District, and right next to that is the Royal Botanic Gardens. And if you walk along the edges of Sydney, you can see some of the beautiful coastlines and beaches. And it was a really great experience for me. And Australia is a solid choice for anyone wanting to go on a QAS experience. And here are some of the things that I did to prepare for my trip. So we had weekly QAS intern and scholar meetings here at the forum, which were led by James. And I thought that this was a really good experience to get to know all of the other QAS scholars and some of the really interesting work that they were doing. We had some practice, doing research, giving presentations, learning about deliberative dialogues and how to facilitate them. And I think that this experience was really important for some of the work that we would be doing abroad. And the forum gave us a lot of support in getting visas and booking flights and planning accommodations and all of those logistics, which really add up. And I think having the forum support made things a lot easier to plan this big 3-month trip. I also spent some time reading up on the Australian healthcare system and the work of the New South Wales Ministry of Health, because I really wanted to learn about some of the similarities and differences between Canada's healthcare system and Australia's healthcare system, and also some of the priorities of the New South Wales Ministry of Health, so that, you know, when I got to Australia, I'd be able to hit the ground running and I'd be able to learn as much as I could. So 3 projects that I worked on in Australia were, number 1, I performed a narrative review of knowledge translation frameworks. So looking at some of the models for translating research evidence into effective policies and programs. Secondly, I prepared a manuscript describing a government-run Aboriginal population health training program. And finally, I helped in developing a population health research strategy for the state of New South Wales that would guide population health research in the state over the next 5 years. So my first project was on knowledge translation frameworks, and I worked with the director of the Evidence and Evaluation branch of the Ministry of Health. And he had done a lot of his PhD work on this topic, so he had a lot of experience, and I was able to learn a lot working with him. So we recognized that there was a significant gap between research evidence and policy making. There was really good research evidence out there, but oftentimes it wasn't being used effectively to generate the best policies or the best programs. So we looked into the literature and we saw that there were many different models or frameworks out there for bridging this gap, and our goal was to synthesize all of these different frameworks. So this is an example of what a knowledge translation framework looks like. So this is the Knowledge to Action framework by Graham et al., published in 2006. So you can see here at the center is knowledge creation, and it moves towards the bottom, which is the action cycle, where you identify the problem, you adapt the knowledge to local context, and then you select, tailor, and implement interventions, and it's a cyclic process. So this is one of the many models for moving from knowledge to effective interventions. And we wanted to see how many of these different models were out there, what were some of their similarities and differences, and what could differentiate the successful models from the models that weren't too successful. And so we searched PubMed for all the papers published between 1990 and 2014 that described knowledge translation frameworks. We included 98 papers and we identified 41 different frameworks. So we created a summary table of all these different frameworks, including their key elements, how these frameworks change over time, and the different contexts in which they were applied. So this is an example of our table. You can see that we've included the framework, the number of studies that they were that talked about this framework, some of the key elements of the framework, and how it has been revised over time. Some of the contexts they were applied in, for example, health behavior change, family medicine, food labeling, patient-centered medical home, and then some of the key implications of the framework, or the things that we could learn from this framework and how it was applied in practice. And so we found 41 different frameworks, and we learned that there really were many different models for translating research evidence into policy making. And collectively, these frameworks, they try to improve the use of research evidence in policy making, but they did that in many different ways. And we found that some frameworks were more successful than others in translating this research evidence into effective policies and programs because they took into account contextual factors. So they recognize that when you have knowledge, you have to tailor that to the specific needs and the specific barriers, challenges, and opportunities in that local context in order to come up with good interventions. And they also recognize that knowledge translation is a cyclic process, that knowledge and research is constantly evolving, and that your needs, opportunities, and challenges are constantly evolving too. So you really need to go back and forth in order to come up with the best interventions, and you have to continuously revise and evaluate your policies and programs to make sure that they're effective as possible. And this work will be published in the Australian journal called Public Health Research and Practice in the next few months. My second project was on the Aboriginal population health training program. So I worked with the directors of the public health training programs and Aboriginal health at the ministry. So the APTE was a program established in 2011 to provide population health training specifically for Aboriginal people. So the reason this program was developed was because the ministry realized that Aboriginal people were underrepresented in the Australian health workforce. And there was a lot of good data out there suggesting that if you increase representation of Aboriginal people in the health workforce, you can improve Aboriginal health outcomes. And specifically for population health training, the ministry recognized that if you have more Aboriginal people developing policies and programs, you're more likely to create culturally safe programs that Aboriginal people will use. And this was one of the first programs of its kind in Australia because it specifically targeted Aboriginal people to increase their representation in the population health workforce. So the APTE is a 3-year population health training program, and the trainees complete work placements in the population health department at the Ministry of Health, and they study concurrently towards a Master of Public Health degree. And 15 trainees have been recruited since 2011, with many of the graduates securing management roles in population health. So it's really been able to achieve some of the objectives that it set out to achieve. And so my role was to prepare a manuscript that would describe the development of the APTE and include data from a 2014 evaluation of the program. So the program has been running for 5 years, and we really wanted to publish a paper and to get the word out there about how this program was developed, what we thought made this program successful, and encourage other jurisdictions in Australia and countries around the world to perhaps start thinking about increasing their Aboriginal representation in their population health workforce in some way. And so in this paper, I presented evidence on Aboriginal health inequities in Australia, the underrepresentation of Aboriginal people in the health workforce, and the fact that there's a lot of data suggesting that increasing Aboriginal representation in the health workforce can improve Aboriginal health outcomes. So I described the need for a program like the APTE and how this program was developed and implemented in New South Wales, results from the 2014 evaluation, and what we thought were elements of the APTE that were key to its success based on the feedback we received from trainees as well as from the people who developed the program and from the supervisors of the program. And so based on all of this, we tried to argue for the need for more programs like the APTE in Australia and around the world. And this work is under review for publication in the Australian Journal Public Health Research and Practice. And the third project that I worked on in Australia was developing a population health research strategy for New South Wales. And I worked with the entire evidence and evaluation branch of the Ministry of Health. And so our goal was to create a document that would provide strategic direction for population health research in the state of New South Wales for 2017 to 2021. And the ministry funds a lot of population health research projects. So we really wanted to make sure that researchers and clinicians and the public knew about what our priorities were so that research would align with some of our priorities in the state. So this was a really big project that took a lot of effort from team members, and we developed 4 briefs that we presented at an advisory group meeting that would give us direction on how to start thinking about creating this new strategy. So a lot of this work was done by other members of the team, and I helped to create 4 different briefs that we presented at this advisory group meeting. So I really made concise summaries of all of these different aspects of work that we did. And so the first brief focused on a synthesis of population health research strategies from other jurisdictions in Australia and around the world. So we really wanted to see what other population health research strategies were out there, what we could learn from them, and what we could apply to our own strategy. We interviewed key stakeholders, for example, Ministry of Health leaders, some of the prominent population health researchers, and some of the managers in local health districts. And we really wanted to understand what they thought were important priorities, where they thought gaps in research were, and how they thought that we could better address these gaps in a population health research strategy. Thirdly, we reviewed strategies for increasing the use of research evidence in policymaking. And so this research we commissioned to the Sachs Institute, and they came up with a rapid review that allowed us to better understand what some of the strategies were to better translate research evidence. Because not only did we want to promote higher quality population health research, we also wanted to make sure that that research was being used appropriately and translated into effective policies and programs. And finally, we reviewed progress made under our previous 5-year strategy from 2010 to 2015. And we wanted to see whether we were able to achieve some of our objectives, where we fell short, and what we could do to better address the areas in which we fell short. And so I helped organize an advisory group meeting that consisted of leaders in the Ministry of Health, researchers, and managers in local health districts so that we could discuss how we could start developing the 2017 to 2021 strategy. So I helped present the 4 briefings, and I took notes, and by the time I had left, I had helped with creating a first draft of the next 5-year strategy. And so those are the 3 projects that I worked on. I really enjoyed my time in Australia. I felt that I worked in a really collegial environment, and I had a lot of support from all of my colleagues in the work that I was doing. I gained a lot of insight into the inner workings of government, and I better understood how decisions were made regarding health policies. And as an outsider looking into government, oftentimes we may think that government processes are really slow. And being an intern working in government, I could see some of that in that, you know, if I were an intern and I came up with research evidence that supported a particular policy or program, it would have to go through many, many different people and many levels of government before it reached someone that could actually make a decision on how to come up with a good policy or a good program. And, you know, that means that there are a lot of checks and balances in place to make sure that we use the best evidence and that we come up with the most coherent arguments. But again, it takes a lot of time for that process to happen. And again, there are politics in play, there's funding at play, and so oftentimes we might not be able to use research in the best way possible because of all of these limitations. But nevertheless, I really enjoyed working with all of my colleagues. I was able to immerse myself in Australian culture, and I learned something new every day in terms of you know, the foods that they liked, the celebrations that they held, their politics and their elections, which for me was a really enriching experience. And I was also able to appreciate some of the beauty of the country. Every weekend I would spend time with some of my friends, other QS interns and scholars, and you know, we go to the beaches and mountains. We would take ferries along the harbor and see all of the beautiful sights that Australia and Sydney had to offer. And these are just some pictures. So on the left is the view from my desk, which was really nice. I could see the harbor and the famous Harbor Bridge every day. And on the top right was my workspace with 2 really big monitors, which I still miss to this day. And the bottom right are all the amazing people that I worked with. And this is just me having fun with my fellow QES interns and scholars, Chris and Alex, both of whom worked at the Sachs. And that's me surfing, and that's just me on the coastline. And thank you. Just before I end, I just wanted to say that the QS experience was awesome, and for those of you thinking about it, you should do it. And I promise that you won't regret it. If you have any questions, please email me, and that's my contact.
Well, thank you very much, Ben. That was excellent. So we'll open it up to questions if anybody in the room has a question. If you're online and you have a question, feel free to type it in the chat box. So what I'll do is I'll ask a question or two while people think about their questions, and we'll see how things go. So the first question is one that probably a lot of scholars might be interested in knowing about in terms of workload. So you worked on 3 very defined projects over a 3-month period. Did you work on each of them throughout the 3 months, or was this a situation where you did one project, you finished it, they gave you the next project, you finished it, and so on?
Yeah, so those are the three main projects that I worked on. I also worked on several other small projects on the side, and these were all continuous. So it wasn't that I worked on one project, stopped, worked on another one. And the reason was that these were kind of longer term projects, and I would have to wait to hear back from some of my colleagues and some of my supervisors to hear some of their feedback. And I really enjoyed working on multiple different projects at once because it's harder to get bored that way. And you really learn a lot because these were really, really collaborative projects which required input from many different people with many different skill sets. So yeah, in terms of managing the workload, I was there 9 to 5 every day, and I never really had to stay late except for a few days. So the workload is very manageable, and especially at the ministry with really good support from everyone, I felt that it was quite manageable.
Thank you. So I'll ask a second question while people are still thinking. So from a health systems perspective, now you've experienced a different health system other than our own in a different country, in a different state. So how does the New South Wales ministry or their health system equate to our own? So maybe think about it from what is the biggest difference, do you think, between Ontario and New South Wales in terms of their health system?
That's a tough question, James. Well, if I had to think about it, Australia and Canada have, similar healthcare systems in that the majority of it is publicly funded. I think some of the priorities of the Ontario government and the New South Wales government are quite in line with each other in that they're really focused on not just improving health outcomes for the population as a whole, but making sure that they achieve health equity. And they do that by focusing on marginalized populations such as Aboriginal people, refugees, and immigrants. And having worked on an Aboriginal health project in New South Wales, I really got the sense that there was a strong commitment to helping those who were less fortunate or did not have the resources to attain health as well as the general population. And, I think as a health system, focusing on those people who need the most help was really great, and I appreciated learning a lot about that in Australia and coming back to Canada and looking at some of the work that Ontario was doing with refugees and with immigrants. I thought that work really aligned with each other.
Thank you. So I see someone online is typing, so we'll pause for a second. Let's see what the question might be. But now you're in medical school, so I guess the next logical question would be how has your knowledge and experiences in health systems, how will it shape you as a physician?
Yeah, so as a physician, one of my biggest goals is to provide good care for marginalized populations. And right now, at the University of Toronto, I'm based at St. Michael's Hospital, which is an inner city health hospital. And here we see a lot of homeless populations. 15% of the people who come into our hospital doors are homeless. And, as a physician, I really want to provide the best care for these people. And, learning about health systems, learning about all of these health inequities from a health systems perspective, I think really gives me a clear picture of, some of the big inequities out there in our world. And I think as a clinician, seeing individual patients, I think that'll be a constant reminder of how much work we still need to do. And I think this will, really motivate me to provide the best care for marginalized populations.
Great. Thank you very much. So I'll throw it out again if anybody has any questions, anybody in the room or anybody online. We now have one online, so I'll read that out for those who are watching this later on. As you were managing multiple projects simultaneously, were you able to complete all of them during your time abroad, or did you finish some of them remotely once you got home?
Thank you for that question. So I finished most of them when I was abroad, some of the smaller projects, but the bigger projects like developing that population health research strategy that's still ongoing. I was able to contribute to a first draft of that strategy, and the team there is continuing to work on it. Some projects I continued when I was back home, for example, the Knowledge Translation Frameworks project. We were about 80% done when I had left, and we had submitted that for review before I had left, and we got some comments back when I came back home, and I just did maybe 10, 20 hours of work when I was back here, and that was it for that project. And for the Aboriginal health, population health training program project, that work is still being done at the ministry, and if they need any input from me, I'd be happy to help with them. So most of my work I did abroad, and I just spent a bit of time here back in Canada to tie up some loose ends.
Thank you. Thank you for that question online. So everybody in the room seems fairly quiet, so nobody is giving any indication about asking any questions. I'll ask one more time if anybody online has any questions. But otherwise, I think we're quietly drawing to a close here, Ben. So I want to thank you very much for coming to the forum today and doing this presentation. It will be uploaded to YouTube for all to enjoy later on. I will direct everybody's attention to the links that are currently on the screen. So that first link, if you're interested in the Queen Elizabeth Scholarship Program run by the McMaster Health Forum, that first link will give you all the information you need to know about the scholarship. The second link is a list of all of our webinars. So this is actually the last of our first grouping of webinars, but we will have more in 2017. So keep an eye on that page for a future schedule of more webinars. And all of the past webinars are also still linked there. And then our last link on the page is actually to our blog site. So all of our Queen Elizabeth scholars will be writing a blog post about their experiences. All of them will be posted onto that website. So stay tuned to that. As they become available, we'll be posting them there. And otherwise, thanks again, Ben, and thanks for everyone who joined us here at the forum and online. And we hope to see you soon in 2017. Thank you.